Older Americans Act Title III Planning Committee. I will be chairing the hearing today, and welcome to you all, most of you who are online, and for those of you who are in the room today. Today, Trellis is a nonprofit organization designated by the Minnesota Board on Aging as the area agency on aging serving the 7-county metropolitan area region. We are glad that you joined our public hearing today and look forward to hearing your testimony. Today's hearing is to receive your testimony about the draft strategies in our area plan and the corresponding budget to be submitted to the Minnesota Board on Aging in mid-August. 2025 is the first year of our four-year area plan. The area plan forms the basis of formal agreements between the Minnesota Board on Aging and Trellis. The goals and strategies set forward in the area plan are required by the Minnesota Board on Aging based on what they have determined the priority needs of older adults and family caregivers across the state. Area agencies on aging in Minnesota have some discretion about the activities they undertake to fulfill the requirements of the Minnesota Board on Aging, and can also determine with some limits the allocations of the Older Americans Act dollars and resources budgeted to implement the plan. In addition to learning your perspectives on our plan and budget, we also are seeking feedback on our cost-sharing policies implemented as required by the Minnesota Board on Aging. Your verbal input and written comments we receive will be reviewed by the full Board of Directors of Trellis. Thank you again for attending. We look forward to hearing your input, followed by a brief overview by two of our staff, beginning with Don Simonson, our CEO and President of Trellis. Don?
Thanks, Jeff. Thank you everyone for attending today. We are going to advance our slides here. We're having a few technical difficulties. There we go. As Jeff said, Trellis is a nonprofit organization designated under federal law as the area agency on aging for the 7-county region. Now, this designation is made by our state unit on aging, the Minnesota Board on Aging. Next slide. The Minnesota Board on Aging administers the Federal Older Americans Act program. And one of its requirements as the state unit is to develop a multi-year state plan on aging. The current plan was developed last year. The MBA's plan is organized around the 5 major goals noted on the slide. These are namely equity, aging in community, caregiver support, healthy aging, and dismantling ageism and promoting elder justice. The MBA directs the 7 area agencies on aging in our state to organize our strategies and budget to help achieve these goals to support older adults and family caregivers. Our plan is undertaken with advice from our Community Advisory Committee on Aging. I'll spend just a few minutes on the next slides. I know that you have access to this material via our website, and for those of you who are in the room today, so I will not cover this in detail. But you'll see that we've organized the goals that the Board on Aging's state plan advances, and we have selected and highlighted some of the strategies and activities that we'll be undertaking. For example, the Board on Aging requires that area agencies on aging serve the target population through partnerships with our community providers. Now, historically, states were directed to target Older Americans Act services to those in greatest social and economic need. In February of 2024, the Federal Administration for Community Living clarified the definition of greatest social and economic need to include additional factors such as disability, language barriers, HIV status, housing and food insecurity, geographic location such as rural residing elders, and more. Now, the final rule or regulations to the Older Americans Act where these changes were made was updated, as I said, in February of 24, and the implementation date is October 1, 2025. There are many new requirements and changes in policy in these regulations, and some will be passed down to our providers who receive Older Americans Act funding. In response to these new targeting requirements and the final rule, encompassed in the final rule, we will seek opportunities to better serve older adults in the expanded target population, including those with HIV or who are experiencing insecurity related to basic needs such as food and housing. Goal number 2 is to, next slide, make aging in community truly possible for all Minnesotans. Now I call your attention here to a newly proposed strategy to explore creation of an equity fund that will bring new resources to local partners serving the target population. Also, note our intent to advocate for additional state funding for meals and supportive services, and our ongoing provision of senior linkage line services, including Medicare counseling, care transition support, and outreach. Goal number 3, support families, friends, and neighbors in sustaining their caregiving roles. In addition to ongoing training and facilitations for organizations supporting family and friend caregivers, we will disseminate new tools that will help us all better understand isolation of caregivers who care for someone with memory loss, specifically in communities of color. Goal 4, promote and support healthy aging for all Minnesotans. You'll see here that the activities include compliance requirements driven by state and federal bodies, including the Office of the Legislative Auditor and the Administration for Community Living. In addition, Goal 4 includes some of our program development and coordination strategies. Generally, we organize our work around 4 kinds of activities: access, advocacy, program development and coordination, and administration. In this particular goal area, we're proposing to establish new partnerships with the disability community, specifically focused on people with memory loss and their caregivers. We wish to grow health promotion services in underserved communities and outlying suburbs, and initiate solutions in the metro region derived from the multi-sector blueprint on aging, a plan in development that aligns in part with the state plan on aging. Goal number 5, dismantle ageism and promote older adult rights, autonomy, and protection. Recognition of ageism as an equity issue is growing, and we propose to examine our own messaging, knowing that we have a big reach and are sometimes a model for other organizations. I want to take us, I'd like to take us, we're having a few technical difficulties today. Just one moment. We're going to spend a little bit of time on our specific program development and coordination activities that we have not covered already in our slides. Also, I wanted to be sure to tell you that we will send our slides out to all of you following today's hearing. I'm just going to go forward with my remarks. Program development and coordination, we propose to request up to 25% of Title IIIB funds to support. These specific activities include seeking additional funding, as well as expanding the Volunteer Driver Coalition to a national group to advocate for parity with business travel in the charitable rate. Timing is essential here as there's growing bipartisan support in Congress for this measure, and 2025 will be a critical year. Also in program development and coordination, we intend to pursue establishment of a veterans-directed care program in the metro region. This self-directed care program is available for veterans in Southwest Minnesota, but not in the metro or other parts of the state. Of significance, you'll see that we will be working to bring additional voices of Native elders into our policy and program development. Finally, with the 7 metro counties, we have piloted short-term wraparound care coordination and service delivery for vulnerable adults in the Adult Protective Services Program. We will continue this work in 2025 and also seek sustainable funding. Let's move on to the budget presentation. This slide is simply a reminder for all of us that we are facing funding levels in 2025 that are approximately at pre-pandemic funding levels, which is a much reduced level of funding certainly from 2023 or 2022. So what does the preliminary budget look like for 2025? We expect a total of $13.6 million. This is a combination of federal dollars as well as state nutrition dollars, including the one-time state nutrition dollars that the coalition was able to secure 2 years ago, and that will be distributed over 4 years. We project total federal and state resources, as I said, of $13.6 million, but again, this is a projection. There will be some changes, particularly in the federal availability throughout the year. Now, federal and state laws are prescriptive in their use of these funds, with some exceptions about which services can be funded under the 6 titles. And you'll see here the 6 titles: administration, supportive services, congregate and home delivered meals, health promotion, and caregiver support. Now, I think it's important as context for this budget to understand the population we are charged to serve. There are approximately 659,000 people, 60 plus, living in our planning and service area, or 49.8% of the 60 plus population lives in the metro region. Through the MBA's funding formula, Trellis receives 45.2% of the total resources available. I mentioned that we have some flexibility in transferring resources from one title to another, and we make these transfers both to allow us to fulfill our obligations to the Board on Aging in fulfilling the goals that they've proposed in the State Plan on Aging, and to move funds where they are most used and most needed. You'll see here that we propose to transfer 50% of the funds in the congregate dining title to support home delivered meals. We also propose to transfer funds from congregate dining to supportive services. And finally, we propose to transfer funds from supportive services to program development and coordination, which is to support our internal operations. At this point, I'll turn the slides over to Amanda Nickerson, the director of our Older Americans Act program, to address cost sharing.
Thanks, Bob. As part of the notices for today's public hearing, Trellis published our cost sharing policy, which detailed requirements for our provider partners funded with Title III. We welcome your comments on these today. Federal law requires that all recipients of OAA services be offered an opportunity to contribute. The Minnesota Board on Aging requires that this be done through 2 methods. One is a method of cost sharing, and the other is a client contribution. The MBA requires that Trellis administer these policies, and in our role as administrators, we are required to monitor the application and compliance of these policies. Trellis has historically included the MBA recommended sliding fee scale in our contribution policy posted online. While the OAA is not a means-tested program, service providers are required to offer an older person or caregiver an opportunity to contribute, along with a message that service will be provided regardless of their ability to contribute. The services on this slide are designated by the Minnesota Board on Aging to separate between services subject to cost sharing methods and services where cost sharing is not allowed and contribution is encouraged. The Special Access Service is a service designated specifically to providers who deliver culturally responsive services, providing translation for important resource navigation opportunities. And that is a service that Trellis seeks an exemption to the cost sharing requirement. The information on this slide includes key contact information for Trellis staff that are connected to the Older Americans Act program. And I will hand it back to our chair of this hearing, Jeff.
Thank you, Amanda. At this point, we do not have anybody that has actually signed up to speak, but there are a number of you who are online and would like to entertain the notion for you to make comments if you'd like to testify about the material that we brought forward to you here today. If you'd like to speak, I guess at this point, maybe raise your hand and indicate that you would like to speak. And we've allocated up to 5 minutes per person to make some comments or testify if you would like to do so. And we can call on you as we see that your name is raised. And then we'll try to go through that. Please keep in mind that this is a testimony and not a Q&A session. So we're here to hear what you have to say. We'd like to take that material down and share it with the rest of our board and deliberate the comments. And they are very important for us as we try to make decisions in the future on how we should guide some of our comments as we distribute these very limited set of dollars that are available to the community. So with that, I cannot read, but maybe David, you can help me here.
Yep, Terry Wilders.
And Terry Wilder, if you can turn on your screen and present yourself and what organization you represent, if any, and take it away.
Hi, thank you so much.
Oh, you went on mute. You started out on mute.
Yeah, I think somebody muted me by accident. Hi, so I'm Terry Wilder. I didn't think I was going to be able to attend today, so didn't prepare, but now that you've invited us. So I am the HIV and aging policy person at SAGE. SAGE is a national organization founded in 1978. And we mainly serve older LGBTQ plus adults, and that includes people aging with HIV. And I'm just wanting to recognize that right now in the United States, 50% of all people living with HIV are 50 and older. And by 2030, 70% will be 50 and older. Depending on where you live in the country, those numbers could look higher. And, you know, we in the HIV community have been kind of thinking about this as a silver tsunami. And, you know, we're just really concerned about how we can do a better job between the collaboration between the two networks. The HIV community seems to be over here and the aging network seems to be over here, and we need to be holding hands. And, you know, we know that if older people living with HIV have not started coming to OAA funded services, they are certainly coming. And how are we going to be prepared to make sure that they feel welcomed, that it's a stigma-free space, and that there's going to be services and programming that is appropriate for their needs. I also want to recognize that many times older people's sexuality and their sexual health needs are not recognized. So thinking about health promotion services and having a programming available around sexual health, HIV prevention, STI prevention is really important, particularly as we look at the recent CDC's 2022 HIV surveillance report, where we are still seeing folks in particular 55, 65 plus still acquiring HIV. And many times when they're diagnosed with HIV, they already have advanced disease, which means that they're not being tested early when the virus was first transmitted to their body. And then that also tells me that we're not reaching them with HIV prevention information because we now have a pill people can take to prevent themselves from getting HIV. So I would love to, work with you all. I'm based here in Minneapolis, even though I work at a place that people typically think of being in New York City. So I care about my community, and I would love to partner with you more. I aware of Bill Tiedemann, who works for you, but would love to have larger conversations about the Older Americans Act services and older LGBTQ plus adults and older people living with HIV, and how we can make sure that they're included in these conversations and these service delivery plans. Thank you.
Wonderful. Thank you, Terry, so much for your comments. It's certainly an area that is becoming more and more evident as we all get a little bit older in our ages, as far as technology is allowing people with different abilities and disabilities to live longer in this day and age, that's for sure. Is there anybody else on the screen that would like to speak? If so, raise your hand with the little indicator. We can identify you and give you an opportunity to say a few words. And I see we do have a raised hand. Mary Albright? Albright? Mary, would you like to speak? And I think you're on mute.
There.
There you go. We can hear you now.
Okay, great. I wasn't really prepared to speak today. I didn't know until yesterday that I'd be able to make this meeting. So, and I thought there would have been an opportunity to do some questions and answers, because my responses would really be based on answers to some of my questions. So here goes. I'm with Longfellow Seward Healthy Seniors. We're living at home block nurse program. And we currently get Trellis funding from for homemaker, primarily food distribution, shopping and delivery, but also some traditional homemaker services and special access services as well. And so I'll have to describe this as my concerns, given the level of information I have, which is minimal. I would be concerned if you're taking money away, if what you're planning to, or what you're proposing would take money away currently from the amount of funding that's available for Trellis supported 3B services. Okay. I think that's kind of a no-brainer. And I mean, we have a very small staff. And I don't know, I know there's varying sizes of organizations that get Trellis funding, but, combine all of our staff together and we're, barely at 3 FTE, actually a little below that. So we deliver a lot of services on few staff. And from what I understand, Trellis, I'm not trying to sound derogatory here, but I've heard that Trellis has over 100 employees. So we're expected to do a lot of work with few staff. And I would hate to see that. I mean, I understand that planning takes staff time and resources, but if that's going to mean that there's a reduction in the amount of funds that grantees can actually have access to provide services, then we kind of have a disconnect here. But you also said that you're going to try to get more state funding. So I don't know if that state funding would replace the amount of money that you want to use for your planning expenses. So am I getting my concern across to you?
Yes, you are. You're
Okay.
doing a very good job.
Okay. And it's just really off the cuff here, because I was going to ask you some questions. I'm kind of a numbers cruncher. So I was going to ask you some questions like, well, how much will what you want to take for planning costs for your staff, for Trellis staff, to make these changes? How much money will that take away from the available money for grantees that are actually providing the services to people. So, I mean, that's my primary concern. Without knowing that information and without knowing how successful we may or may not be in getting additional funding from the state, I don't know what the overall reduction is going to be for next year for the amount of money that you have to award for Title IIIB services. So that's my primary concern, is if what you're proposing is reducing that, and we already know the amount is going to be reduced fairly significantly next year anyhow, because all the COVID stimulus money has sunsetted, then I'm concerned what that's going to do, and will it limit our actual ability, grantees' ability to provide services, because we're going to have less money available, it sounds like, at least for next year.
Thank you, Mary. Your point is well taken, and nothing is going to replace the dollars that we received during COVID. And unfortunately, we're all realizing what that is doing to all of our budgets. As far as your questions, I would encourage you to contact either Amanda or Don outside of this meeting, and I know they would be more than happy to explain the details about how the dollars are allocated within Trellis itself. As far as the board is concerned, we're very concerned about the ability to stretch our dollars as much as possible, but yet, because of increased accountability measures, because of a few bad actors and other programs unrelated to aging, we have now more accountability requirements than ever. And so we have to adhere to much more stringent bureaucracy, if you will. I'll leave it at that and let Don and Amanda or whoever talk to you more in person about the details, and let it go from there.
Yeah.
I wasn't even supposed to make those comments, so
Okay.
I'm trying to make comments too.
Yeah, and that's giving me a little more information as well, but it, in the end, it kind of rolls down to numbers. I mean, I realize we're talking about short-term consequences and maybe short-term pain compared to long-term. Hopefully we're getting more funding, but in this economy and the world we live in, we're all trying to get through our current year. and I'm sure you can relate to that.
Yeah, we can certainly understand, and we sympathize with that as well. Thank you very much for your comments. Are there others in the hearing room or online that would like to testify regarding the presentation that was made earlier to you today? We have about 20 of you on the screen. If anybody would like to speak, just click your raised hand, and we'll leave this option open here for a couple more minutes, and if we don't hear anything, we'll conclude the hearing. Kristen, would you like us to come forward and show your camera?
Oh, I think I am on camera.
Oh, yeah, you are. I'm sorry, I can't read the fine print.
Okay. I don't never like to be anonymous and lurk in the sidelines.
Thank you.
Good afternoon. I'm Kristen Rigg. I'm the Executive Director of the Living at Home Network. And I have a lot of member staff who are on this call. And I haven't ever done this before, so I'm appreciative of your guidance for it's not a Q&A. What I would just say is that on behalf of all of our members, that they do incredible work in their communities across the state, and for without a lot of resources, as you know. And so I guess what I would say is the sympathy is appreciated. I think that we as a network of small organizations really seek to partner with organizations like Trellis, the other area agencies on aging, on behalf of these organizations that are doing the incredible work of serving older adults in our community. and that they, the staff, are deserving of the resources to be able to have adequate pay, to be able to dedicate themselves to the jobs, to not have to take multiple jobs, to not have to figure out how to put together healthcare resources for them and their families. And so I can understand that it's a both and situation, but I feel as the representative of these 32 amazing organizations that I just want to speak for them and say they are deserving as well. And so we look forward to continued partnership and ways to sort of make the pie bigger without having to cut it up amongst all of us. Thank you.
Thank you, Kristen. We appreciate your coming forward and expressing your viewpoints. And as one who's reviewed the grants, it's agonizing, wishing you could do more when the federal government has kept their funding levels at the same rate for multiple years. And we'd love to see more. And so as we work towards advocating and increasing the awareness as much as we possibly can to our lawmakers who have those decision-making authorities to increase allocations, we look forward to having you help us advocate in the future as we try to get these dollars across as many spectrums as possible. Are there any other people who would, individuals on screen or in the room that would like to speak today? If so, raise your hand and we will recognize you to speak. And we have another. Mary, you'd like to speak again? Just hang on a second, Mary, and I'll want to give one more chance for anybody who's not spoken yet the opportunity to do so, and then I'll allow you to make another point. No more additional people? Okay, Mary.
Okay, mine is more of a, I thought, well, if other people are not wanting to speak or testify, can you answer any questions since we do have time remaining? I mean, I guess, and if so, my particular question would be is, it sounds like there may be some reductions in, meal delivery and congregate dining or some switching there, but do you know, as far as the other 3B supportive services, of course, I'm particularly interested in the ones that we provide, special access and homemaker and food distribution shopping. Do you know if there are projected, if the money you want to take out for planning is going to reduce those two service category funding amount? And if so, do you know how much?
I personally do not know that answer, and the purpose for today's hearing is strictly to just submit and ask for your viewpoints. But again,
I understand that, but just because so few people have
sure.
wanted to speak and we have time remaining, I'm just asking the question.
Can
you answer those two questions or not?
And some of those decisions have not been totally made yet. It's still in process. And so that's another reason why we can't answer those questions.
Okay.
But I understand your frustration. It can be difficult at this point.
Mary, I would just like to add that we have plans to communicate changes to all of our Title III funding programs once this budget is finalized and submitted and we have more information. Right now, we're presenting our preliminary plan with the budget that we've been allocated.
And then you can obviously contact Amanda and she could maybe answer more of your specific questions as we get down that road. Thank you, Mary.
Okay, thank you. And we do appreciate your support. We've been a grantee since 2020, and we started as a we got in an emergency grant because our office was directly hit during the civil unrest and was destroyed, and that's how we first accessed Trellis funding, was through an emergency grant.
Well, that's great. And of course, we pivoted to react to the civil unrest and to expand and diversify in that greater diversity.
You did. At a critical time.
Yes, we will continue to do so. Well, with that, I guess there's nothing else. As far as our situation, we've given you everything that we could at this point. Again, if you have questions specific to Don or Amanda, please direct them accordingly. They are in the material, and their contact information is included in the handouts that should have been provided to you ahead of time. And I guess at this time, I'll adjourn the meeting. This meeting's adjourned. Thank you so much for attending today's hearing.